the cause. And fourth is subconscious relearning. And in the book, they have mentioned that every single step is important because it is the hypnotherapy is effective only when we are fulfilling all the four objectives, which is something as a novice practitioner when I started, I also realized that sometimes just identifying the causes, just discovering the cause without doing the subconscious relearning is it doesn't give the complete results. So I could completely resonate with this part. So it is required that we do all the four objectives, but we know that it is always good to start with the first one first. It is always good to start with the
Madhur,
basics.
Madhur,
Yes, sir.
just one moment. Your screen is not properly seen. Everybody is able to see the screen properly. There are some black patches.
Yes. 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 I
Yes,
thought
sir.
it's on my
Can
computer.
you
Yeah.
Is it
can
gone, sir,
you
now?
you
Full screen, full screen mode
stop
कर दो.
sharing and then share again, perhaps.
Okay, okay, I'll just try
Yeah.
that again. I think the Zoom, because it is getting shared through Zoom, it is
Uh,
showing on the screen that. Uh, just-
Share again.
okay, I think this will be easier. Is it visible now?
No, it's same. Like that black thing
There are
is.
some black patches and
Maybe
matlab,
that's the design of the.
portion of the slide is always covered.
I
But I
think
think we
it is the Zoom part.
uh,
Uh,
it seems
uh,
so. And now there is
yeah.
another thing you have come in the presentation also over and above your window.
Yes, just let me find
So
again,
this
sir.
is AI. This is AI. Hmm.
आप अपने पीपीटी को full screen पे कीजिए, then maybe it is better.
It is on full screen, ma'am. I think still. How does it look now?
I think we go
The
ahead with
black patch is
this.
still there.
We need to go ahead with this.
I'll just try to.
This is the no, now
Now
it's
this is
better.
better, I guess.
Yeah,
Now this would be better.
can do.
Okay. 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 Oh, sorry for that. So there are four objectives. One is suggestion and imagery, where we are establishing the therapeutic state, talking about trance, helping the person understand about hypnosis, getting started. Second is discovering the cause, where we bypass the conscious resistance to understand what is the root cause and what are we actually working on. Third is releasing the emotional energy or releasing the emotions attached with the cause. And fourth is subconscious relearning. So says that effective results require all the four objectives should be fulfilled. We cannot just discover the cause and come back. Knowing is not enough. We still have to do the remaining work. And even when we know that all four objectives are necessary, by using suggestions to increase the motivating desire to change, the client is more likely to show up for the next session because the regression therapy not necessarily would happen in one single session. Sometimes it requires multiple sessions. So that is why it is important to start with the first step first. And the positive suggestion and imagery will also leave the good impression on the client so that their motivation to work and to experience the state again also increases. When do we use hypnotic regression therapy? It is for the clients who have problem that has a core cause that originated in the client's past. It is usually childhood, but not necessarily that it would be always childhood. Sometimes when the client comes and they start talking to us and they can remember the timeline, from this moment I started, once it happened that I was trapped in a lift, and from that time point, I am afraid to go in a closed space. So they are telling us a proper timeline. They are telling exactly where the problem happened. What do we exactly do? We look for two kinds of events, one that caused the problem and another one which actually activated the problem. So one that caused the problem is what we call the initial sensitizing event, the root origin, which might happen in childhood, might not also happen in childhood. And the second one is the activating event, the trigger event that connects the root to the current symptom. It is not always necessary that the activating event is same as initial sensitizing event. Sometimes they are same, sometimes they are not same. Sometimes it may happen that once in childhood, my teacher scolded me and I felt bad and I started fearing authorities. But recently, when my boss did the same, the problem became more. And that was in my last company. In this company, when the boss every time calls me that, you should come, I want to talk to you, then again I start experiencing that anxiety. So initial sensitizing event is in the childhood, activating event is in the last company, but the subsequent events are happening currently. The clinical principle is we clear the initial sensitizing event and the activating event, and the next subsequent sensitizing events usually topple automatically like dominoes. So one of the most I would say, interesting part that I found in this book was the psychodynamic intake evaluation. Like any other client, when the client comes, we will ask them about their socio-demographics. We would ask them about, tell me about your problem, what is happening, what are you here for, how can I help you? Then we ask them, when did it start? When did this problem start? What was going on in your life when it started? It gives us a time frame. Sometimes the client might exactly remember the date. 3 years back on 22nd May they started. So if they exactly remember the date, it means that that is a significant event for them. It gives us a timeline. We also try to understand when did it become a problem. How the client answers this often gives us insight into the motivation to stop. Recently, I came across a lady who had a problem with smoking. She wanted to quit smoking. She said that I wanted to quit smoking like when I got pregnant. I didn't smoke for a long time. During whole my pregnancy, I quit. After that, I had kids and I realized that I should quit smoking, but I was not able to. And then recently I was smoking in the balcony and my son came and I got angry at him. And he told me that, mom, why I come while you're smoking is because when you're talking to me, you keep your cigarettes away. And that is how I'm actually protecting you. Now he's just 10 years old. But that is where the client broke down because that is her motivation to smoke. So the activating event is different than the initial sensitizing event. But this is her motivation. This is where she understands that this has now become problematic and I need to now seek help for it. What makes it better? What makes it worse? And asking the client, if you are cured, what would you do that you cannot do now? This also helps us to understand secondary gains. What is it that the client would do differently if they do not have this problem? What is it that is holding them back in this problem? And this slide is something that I really liked from the whole book, where it said that you have to ask these five, six questions to the client in every single patient, in every single client. We have to ask these questions to understand more about their life. We take their name and ask them, say, for example, Madhur, in your entire life, what's the worst thing that has ever happened to you? That memory takes them back to the emotion of hopelessness. That was the point where they felt hopeless. And that helps us understand that this can be one of the event where they felt hopeless. Not necessarily do we want to work on it right now, but we need this data. What's the worst thing that you ever did? This brings guilt. Sometimes people continue certain behaviors out of guilt as a form of self-punishment. So this also helps us understand how guilty they feel and are they in any way punishing themselves for that guilt. What is the most frightened you have ever been? This can take you back to the experience of trauma, and sometimes it can also lead to sowing the seeds of phobia. What's the most angry you have ever been? Anger is one of the emotion which is generally an acceptable form of fear. So when people feel insecure, they might get angry. So this also helps us understand that is there any insecurity, any fear, or is there an emotion of anger that they have not been able to work on or they have not been able to accept? That is what is something that is bothering them right now. And what is the most embarrassed you have ever been? This helps us to understand the point where they felt shame. And a lot of times that shame, that incidence might be actually the initial sensitizing event. or the activating event from where the problem has started. We also ask them what's the best thing that has ever happened to you. If they say nothing, that means that there is severe sadness or helplessness that they're feeling. If they say that there's a healthy relationship, we are at least also able to understand that there are certain strengths, there are certain good things happening, and the prognosis can be good if we can utilize those strengths. Have you ever known anyone with a similar or same problem? Because at times clients may model someone else, usually one they are emotionally close to, or sometimes that person might also be dead. So the symptom might just be keeping the relationship alive, and the modeling behavior might just keep them stuck in the emotional issues that they are. Towards the end, we asked them if I had a magic wand and one wish would come true, what would you ask for? Ideally, we want to understand the motivation here. We want them to say, I want to get better. If they are not saying that I want to get better and there are other answers, we have to understand after how many times asking the question would they want to get better. It also gives us insight into their strength of motivation. More the motivation, better it is for us to help with them, work with them to get better. And is there anything else that I want that you would want me to know? This is generally the question we should ask everybody, irrespective towards the end of a session. Is there anything else? Some more questions that are important to ask, I think, medically also are about their biofunctions, sleep, appetite. Are there any medical issues? Are there any legal issues? Is there any past medical or psychiatric history, family history, relationship related history, substance use related history? As a psychiatrist, these are some things which help me more. But I think in therapy also it is important to know the different aspects of client's life when we ask about these questions. So what are we actually understanding in that intake? We are understanding the symptom mechanics. How did it start? What makes it good? What makes it bad? We are understanding the secondary gains. Uh, if the client gets cured, what is it that would be different for them? Which helps us to understand the different subconscious mechanism which might be trying to protect them. And it also helps to understand what are the emotional imprints that is keeping the symptoms intact that might be associated with what the patient is feeling, because every symptom would bring with itself certain feelings, and when we go through the process of regression they have to reach to the feeling, not at the knowledge level, not at the data level, but at the feeling and emotion level. So we must understand the psychodynamic rough map of where is the client, what is happening, and accurately mapping it would help us to understand what type of intervention to do, what can be the goal, what is the goal that we are working towards, what might be the strengths and weaknesses of this person. Based on that, we can use certain hypnotherapeutic interventions, we can use certain specific induction techniques, deepening techniques, certain metaphors. So understanding the client would help us to pave the path. But one thing that often happens and one thing that we must avoid is making certain assumptions out of the understanding that we have got. Or you are feeling sad because, or you are feeling angry because you have unresolved parental issues. No, we don't want to make any assumptions. We don't want to put any things in client's mind in awake state as well as in the state of trance. Because hypnotized clients are highly suggestive, so we must avoid projecting our preconceived opinions to avoid confabulation and false memory syndrome in the client. Sometimes, if we are implanting assumptions, the therapeutic work becomes really difficult because then we are going along a very wrong path. What we should be doing is having an open-ended sensory inquiry. How does it feel? Asking WH question. What do you see there? When did this happen? Where do you see yourself? We must uh, allow the client's inner mind to reveal the cause rather than us leading towards the cause. And as the example says here, while the client is in trance, we don't want to ask any leading question like, were you abducted, or is somebody doing something wrong with you? Is somebody harming you? We want to ask questions which are more open. What do you see? What do you hear? It might happen that if something is happening, the clients might experience certain emotions, the clients might start abreacting those emotions, which is exactly what the purpose of the whole therapy process is. So we should not be worried that, oh my God, this person has started crying, so let me close therapy here, or let me lead it fast so that we can reach to the point. We really don't want to do that. We want to let their subconscious lead the whole process so that they can reach to the resolution that is good for them, not good for us as a therapist. So we must prioritize guiding over leading to ensure that memory retrieval is authentic and also to avoid any kind of legal and ethical problems coming up later. So, how do we prepare the client before we even start hypnotic induction? Now, in a client where they do not know about hypnosis, or in a client where they do not know about age regression, we have to give them certain ideas. We have to discuss the whole process with them so that they get an idea of what might be happening here. So we have to tell them about false memories. We have to tell them that no recall is 100% accurate because over times our memories fade. So there cannot be 100% accurate recall. But even if we understand, even if we are able to recall certain things and the emotional tone around it, we can get the work done. The imagination that the client has is a valuable asset to experience good regression. And in the imagination, there is only now. So that is why doing imagery and suggestions at the start helps the client to get an understanding of what imagery is. Sometimes the client says that I'm not good at imagination. Sometimes the client might say that I don't know how to imagine, which is wrong because everybody has imagination. We just have to make the client understand what do we mean by imagination. We are not talking about the skill of drawing, painting, sketching. We are talking about imagination, which everybody has. We also have to mention them that everything that is happening here would remain confidential. Even the things that you will be telling or might come out through trance while you are in trance, that would also remain confidential. We have to explain them the four objectives that we spoke about, that there is imagery, then there's finding the cause, then there is emotional release, and then there is relearning. The purpose of regression is not to fix the blame on others. We don't want to go in there just to find the cause that, oh, your parents did this to you. That is why you are feeling like this right now. Your parents did this to you. That is why you're feeling this right now. No, that is not why we are there for. We are not taking them there to see who did what. We are taking them there to release the emotional energy that is holding them back and to help them relearn how they can get back their authority, how they can take back the control over their life, and how they can challenge or work better, cope better in the similar situations when they happen later in life. The change cannot happen if there is conscious resistance before starting the trance. If the client says right before starting that, I don't think this is going to work for me, then we cannot really expect the change to happen. And it is always good not to force the client. Until and unless the client is not ready to work on something, we do not want to force them that, no, no, let's try this out. It will work for you. It has worked for a lot of people. We don't want to give false promises. We have to keep aside all our preconceived opinions about what the cause can be, and sometimes also the client's preconceived opinions. And we have to tell the client also that whatever you think it might be, that is okay for now. But let us go there like a clean slate and let us see where the subconscious takes us. We also have to, in a very new client, at times, we also have to tell them about the difference between the general idea of conscious subconscious mind, that trance is a natural state. There is difference between clinical and stage hypnosis so that they don't have this idea that, what would happen when I go in this stage of trance, and also help them understand that all hypnosis is self-hypnosis. So it is them who would be doing the work. It is them who would be taking themselves to the stage of calmness. You're just a medium. Another thing that we want, which is very, very important, especially in uh, regression therapy, is understanding the ideomotor signals and at times also pre-deciding what are the ideomotor signals going to be. What I have seen, I predominantly practice online. So what I have seen is online ideomotor signaling becomes a bit difficult, but in clinic, it is really something very important and useful. In certain clients, we have to establish a peaceful place and anchor that with ideomotor signal. because then it becomes easier for them to go to that peaceful place. It is also important to establish the peaceful place because at times, if the reaction becomes very intense, then we can bring the person to the peaceful place to, calm them or to reduce the intensity of that reaction. We have to set four ideomotor signals: yes, no, I don't know, and I am not ready to answer yet. If we are only going with yes and no, then it might become difficult to interpret the client signals because there might be certain points where the client does not really know what is happening or what is right or what is wrong. So we have to tell them that memory is fluid, imagination is the language of the subconscious mind. The we have to optimize the expectations. The goal is emotional release. It is not just finding the data of what happened in the past. And we must verbally make the contract right before we start that shall we start the process, or are you ready, or should we move ahead, so that we take a yes from the subconscious, from the person, to be able to work on that. If there is resistance, sometimes we can use in our script, you could resist if you wanted to, but that's not why you are here, which is again like the Ericksonian principle of utilitarianism, I think, that you use whatever comes. Then in some of the clients, using different techniques, we have to, it is said in the book that we have to go to the level below 50. So through multiple trance, or while we are doing trance with ideomotor signaling, we have to establish and verify the depth of trance. As the client starts going in the state of trance, we might ask them, uh, is it between 70 to 80? You might give me a yes signal. If they say yes, 70 to 80, or you may allow your mind to go deeper. You may allow to relax even more, to go even deeper, and they might go. Then we again ask, is it between 70 to 60? Is it between 60 to 50? Is it between 50 to 40? Like that, we want to go deeper. The clinical rule is that below 50, there is effective regression that can happen. Sometimes the client is very analytical and they might remain above 50, where they are remembering the incidents than reliving the incidents. So reliving is very important. Revivification of the incidents or the memory is very important because that is what also brings the emotions with it. Once they are in that depth, then we may go for whichever modality or whichever work we think is important at that time point. Maybe age regression, regressing to a particular age, regressing to a particular event, or regressing to a particular symptom. But generally, it is better to do it below 50. That is why it is not possible to do the whole process in one go at times. So sometimes it might require to working, establishing a peaceful place, then helping them to go to that depth might take a time in itself, and then the rest of the work. So with ideomotor questioning, we utilize the finger response to understand where does the symptom come from. Now, there are said to be 7 different reasons which might lead to the symptom formation. Now, this is something which I really found really fascinating because when before reading the book, when I was doing age regression, I was just going by whatever was coming. But when I found this framework, I realized that it is also important for me to ask the client, is this the reason? Is this the reason? Does it look like this? Does it look like this? Where does it exactly come from? So some of the reasons are: one is authority imprint. It might be some teacher, some parent, or some elderly figure who forced this identity on this person. Some authority mentioned that, oh, you are very weak, or you are very, you get sick very easily, or your immunity is not good. And that might become an authority imprint which the person repeats in their own head. So the symptom might start from there. Then there can be unresolved issues. There can be a current ongoing conflict, which might at times lead to psychosomatic symptoms. So we might ask them, is there any conflict going on? Is there any unresolved issue that needs to be resolved? And look for the finger response. There can be a secondary gain that the symptom might provide protection or attention in some form. So we have to also ask the client, does this symptom help you in any other way? Does this symptom provide you any secondary gain? If that is the case, then we have to work on releasing the secondary gain and simultaneously creating an alternative to fulfill that gain. Is it an identification? Is the client subconsciously modeling somebody else, maybe identifying with the aggressor or identifying with the victim? Is there any inner conflict? Sometimes, if this comes up, then parts therapy might help to resolve the conflict. Is there any past event? Was it because of any historical trauma? Something might have happened in the past from where this problem started. This is where predominantly regression might help. And in terms of inner conflict, I forgot to mention, there can be two conflicting ideas that I want to quit smoking, but I also don't want to be completely healthy. So there might be these two conflicts, and person might quit smoking and then take up some other habit because this part is still there. So we might have to look for what are the inner conflicts happening and understand those parts. And the last one can be self-punishment. As I said, out of guilt, the person might be saying that, no, because I could not take care of my dying grandmother. Now, how can I live happily? How can we celebrate when she is not here, when she is no more, when she might not be celebrating with us? So there can be a form of self-punishment which comes out of guilt, or I could not take care of somebody, or I could not do something. That is what might be maintaining this. If any of these are there, then it helps us to understand once the client is in trance, we try to understand where do the problem come from. We might also explain this to the client beforehand that, sometimes problems might come from all this spectrum. If the client says that my problem is coming from here, then we have to decide which kind of modality do we go to. If there are past events, if there is something like a self-punishment, if there is any unresolved issue, then we might choose to take a modality which might help better in that particular client. So how to go to the regression techniques? So there are different techniques, different portfolio of regression techniques. Once we have established the depth of trance, we have taken them to that trance, we have identified that this is what the problem is because of, then we move into the regression. Now, regression can be done through different techniques. One is affect bridge, where we go to the feelings and try to understand where did it come from the first time. So we ask them that you feel this emotion, and then gradually you intensify this emotion on a scale of 1 to 10. And at 10, wherever you felt it in 10, you go back to that past time where you experienced this emotion. So that is how affect bridge helps us with the emotion to go back in the time to when that emotion or when that problem was first experienced. Similar to affect bridge is also somatic bridge. You might, bring to the surface maybe a physical sensation like tingling or physical sensation like any kind of milder pain, and take them back to where did you first experience this, and then work on releasing that symptom. There can be a techniques like, maybe age regression going back to this age or calendar regression going back as you're counting backwards, or hallway of time that for people who are visual, it is we imagine a hallway of time and tell them that different doors represent different years, and whichever is the year significant for your current problem, your mind might help you to pause there and open the door and look inside to the memory. Some other techniques that I found in the book are affect bridge is one of them, affect tunnel. So feeling is a tunnel. As you're going down, inside the tunnel, the deeper you go, the more intense that feeling becomes. So it is just like affect bridge, but rather than 1 to 10, we are saying you are feeling it more intensely as you go deeper. And at the end of that tunnel, you reach to that instance or that initial sensitizing event. Then age regression can be done from current age to backwards or childhood to forwards. Regression by calendar years, maybe take them to pleasant time and place. Hallway of time, as I mentioned, specific event. There's also one technique they mentioned, deck of time, where there are different cards, and rather than the faces of Jack, King, Queen on the cards and numbers, there are photographs of your lifetime on those cards. So you might ask the client to feel how the cards feel in their hand, to feel the edges, to feel the touch of the card, then look at that, and then shuffle the cards and then put it face down and then pick up. And whatever memory comes up, you might ask them that, now feel what was happening there, go into that memory, go into that emotion, allow yourself to travel to that time which you see in that image. And with the deck of time technique, we take them back to the regression. I mean, we help them regress. Once the client is there, we have to pay very sharp attention at how the client is experiencing and how the client is verbalizing what is exactly happening there. We don't want the client to remember, we want the client to relive. So if the client is saying that I was standing there and I was feeling this way, you know that they are remembering, they're not there. We have to say that imagine you are already right now there and tell me what is happening now. How are you feeling right now? And we have to strictly stick to WH questions, not asking, is your father there? Is your mother there? But better asking, who is around you? What is happening around you? Where are you? What does this time look like? And if the client is not answering, we should not rush to fill in the blanks. We should allow them to take their time to say it. There was a very beautiful line in the book. The feelings are like the passwords that we need to access the data or programming on the computer. So we want to use a feeling to go back to that time. And that is why feelings are really important. We cannot do this work if the client is just remembering and not feeling it. Once the client reaches there, there can be abreactions. Sometimes there are severe abreactions. Some are moderate. They might be crying, verbalizing. Some are very suppressed abreactions. So if the abreaction is very intense, we have to, in a way, dissociate them. We have to tell them that imagine you're watching it on a movie screen, or like we established the peaceful place first, we have to take them out, that you go back to your peaceful place, and now you come back here and experience that this is less intense. The emotions are less intense than what you are feeling earlier. So either we create an emotional distance or we reduce the intensity. In moderate abreaction, we allow the client to abreact. We might offer a tissue, or we might, if we have had earlier established consent, we might put a hand on their hand and help them to settle down, or help them to just feel that emotion in that moment, allowing it to discharge, take their own time. Every emotion will take its own time. Sometimes it reaches its peak, gets released, and then it settles down. If we stop that process in between, then the emotion gets suppressed again, and it might take another session of hypnotherapy to release it sometime later, or the problem might continue. So we have to associate the client in case of suppressed abreactions. In case of suppressed abreactions, we have to help them bypass the analytical block. The suppressed abreactions come when they are being too analytical. We again have to tell them that imagine this is happening now. It is safe for you to feel. Do not try to think about it. You tell me how you're feeling about it. In one of the line in the book was also that if we are working on this whole process and not releasing the emotion or not doing the loop completely, then at times what happens is this particular symptom gets relieved, but then the emotional suppression might manifest as some different symptoms and the cycle might continue. So it is important to allow these abreactions to happen. How do we release? Sometimes we allow the client out of the memory to go to a peaceful place. Sometimes we use gestalt approach. We ask them that you enter into this memory with a dual awareness. You are that child, but with current person's wisdom, knowledge, understanding, training, and experience. That way, it becomes easy for the person to look at that instance from the current awareness, or from the current wisdom, current state, current knowledge, and to find a better perspective or to find a better resolution and allow that child to release the emotions. In certain cases, there might be a perpetrator, or there might be a person to whom the person could not express the emotions or express the whatever suppressed emotions or anger or disappointment they had. So there we can play a gestalt role play. We can ask them that you confront the perpetrator in the safety of your imagination. So we take them back and we ask them, where do you want to go? Who do you want to call in this room? Who is the person that you want to talk to? Sometimes there might be more than one person, but we allow the client to lead and we allow the client to take charge of how they want to do it. And once there is release, we have to confirm that release of the event, release of the problem, and release of the cause. We have to confirm it by asking that, do you agree that, or is this completely released? Do you now release the perpetrator from the apology that they used to owe you? And also ask them that, are you willing to forgive yourself and release yourself from carrying all the hurt that you carried because of this instance all these years? Because it is equally important that they release themselves also from the hurt and guilt that they have been carrying all these years. The last part is subconscious relearning and reframing. Here, when there is a conflict between willpower and imagination, imagination always wins. And after we have released, we have to ask the client to paraphrase in their own word that it has been released, sometimes as direct session, sometimes as indirect session. And we have to ask them to verbalize their new reality and imagine fulfilling the future goals if they're in the similar situations, how they are operating differently. So we can ask them, as a result of what you have discovered and released, how will you best benefit in the here and now and in the coming days, weeks, and months? So asking them to imagine, maybe in a way, age progression, imagine the future situations. How would they be managed differently? How would you feel differently if this emotional baggage that you are carrying is now let go? Towards the end of the session, we conclude the session by ego strengthening, by slowly re-alerting the person. Sometimes when there is very deep trance, there can be headache. So we have to allow them to come out, not rushing it, not always saying that, 1, 2, 3, 4, 5, now you're out. We have to allow them, we have to tell them, you take your time. Whenever you feel that you are ready to come back, you may come back with certain ego strengthening suggestions, feeling better, feeling more aware, feeling more alert. And once the client comes out of the state of trance, we have to not rush in and ask, how was it? What happened? How do you feel? Are you feeling better? No. Even after the client comes out of trance, they might still be in a bit of trance, in a hypnotic state. They might still be suggestible. So we have to be very careful with the words that we might say initially. We don't have to say that unnecessarily you were getting angry. We have to say, allow them. The best thing is to allow them to speak, or maybe ask, do you want to say something about your experience? Maybe say something simple like, rub your palms, feel the warmth in your face, have some water or stretch, the general instructions that we give. So this is the complete blueprint. We do a pre-induction talk and deepening, verify the depth. We talk about ideomotor signals first. Through ideomotor signals, we make the diagnosis of what exactly are we working on. Then we select what regression technique do we want, and then taking them to that instance, to revivification, reliving of the instance. Then through any of the reactions, sometimes abreaction itself works. If there is a client who has something against somebody, then maybe asking them to go there as an informed child or to do the gestalt role play. Once that is done, we ask them about ideomotor, again, ideomotor confirmation of release. Do you think the event, the cause is released? Then subconscious relearning and future piecing, and gradually helping them come out. The ultimate objective is never just uncovering the history. It is to achieve the emotional catharsis and permanent subconscious restructuring. I have been guilty of, initially when I was learning age regression, sometimes I only worked on uncovering it and trying to not doing the future pacing and subconscious relearning. So later the problem still persisted and it needed more sessions. So I personally understood this after the book, where was I going wrong? And that was one of the reasons why I thought that maybe it would be a good idea to discuss about the learnings from the book. So thank you so much. I would like to specially thank uh, all the teachers who gave this platform. And if there are any questions, anything else. I hope I haven't
Very
overshot
nice,
on the
Madhur.
time.
Nice. You can remove the
Yes, sir.
sharing
Yes, sir. I
slides.
will. I will.
So basically, I told Madhur in the beginning only that is a good idea. There can be case presentation, of course, in a clinical meeting, but sometimes we can have this kind of thing also. And especially faculty or some senior students, I would suggest that whatever you are reading, please share. Um, it's a very good initiative. I like the idea of sharing what you have read.
Thank you, sir.
So
Is the screen share off or
definitely,
is it still on?
now it
Now
is.
it's on.
Thank
Okay.
you. Okay, so
Thank you, sir.
Nivedita, over to you. You initiate the discussion, please. Nivedita, you're mute. Unmute.
Oh, sorry. So Dr. Chandarana, sir, is there, sir?
Yes, 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 yes. I would simply say that he didn't only talk about age regression, he age regressed all of us to our basic learning and made the memory more intense, how we can work on every client. It was wonderful presentation, Madhu. Excellent and absolutely methodical presentation in a very, very systemic way to help us to learn how we can go about it. Thank you.
Thank you, sir. I have two confessions, I would say. One was that I use AI to make the presentation because I was of the idea that maybe because of the Foundation Day celebration happening in a day or two, this would happen next month. So I was just relaxing that Nivedita ma'am told me that no, this has to be done right now. And second is that I did not take the whole book. I skipped the past part of past life regression because I thought it would be too big to cover in 1 hour. So I only took the initial
Very right.
basic part.
That's wonderful.
What you've done is right way, in brief. And yes, there's no harm in taking help of AI in preparing the slides. A good thing actually, right? Uh,
Anyone else? Nidhi and Dr. Veena ma'am.
Yes, I would like to say congratulations. First, it's very good book that you have read, and you have done a very good presentation. We really liked it.
Thank you. Thank you.
And I would encourage you to write a review for this book and send it to us. We can make it a part of our newsletter. OH newsletter. If you would
Sure,
like to
ma'am.
do that, it will be really nice.
Sure, ma'am. Sure. I have anyway read it 3 times. Why not write a review now?
Wow, thank you so much. It will be really nice.
Alok is there, I think.
Alok, sir.
Alok may like to.
Yes,
Eh,
Prapanna.
Yeah,
Yes, sir. Sorry, I understand.
Alok.
Alok, sir.
Renu madam is also there. She may like to speak something. Renu bhai.
Renu ma'am.
Pooja is there. if anybody,
It seems
Pooja.
everybody is into so much deep trance that they are trying to work on their issues themselves.
Regression.
Sir, I
Uh,
have two questions. While reading the book, I had these two questions. One was about checking depth of the trance. Because I haven't personally done it in any of the clients. We basically, well, what I have done is that we look at the client and we try to understand through the body language, understand signs of the trance. Should we specifically go to check for the depth of the trance? That is one. And second is one question that I had is before I check the symptom, or where does the symptom come from out of the seven? I have to tell the client that it might come from here, 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 here. So to get it out of the client, I have to also explain them that this is how the symptom formation generally happens. I had a question that can that lead to the false memory, or can that lead to them being biased towards, so this is what it is in my case.
See, your second question, initially, the book talks about uh, open question.
Yeah.
And then the book talks about those 7 areas,
Yes.
guiding the
Yes.
client. So
Yes.
there I had a little bit of conflict whether we should go for only open or we should suggest something.
Mm-hmm.
But then I found it is initially open question, and then if
Mm-hmm.
nothing is coming out or not, we are not satisfied, then indicating them
Okay.
some
Okay.
of the areas perhaps. And regarding depth of trance, whatever way you go, it is just to get an idea. And I don't think it is very significant to
Mm-hmm.
know the depth of trance. He has
Mm-hmm.
suggested, the authors have suggested that, but in any case, depth, I personally believe that it is not that significant.
Okay. Because I also see a lot of clients online, so I can't see their hands. Then I have to rely on either verbal responses or neck movement. And neck movement is where I am worried that the it might become difficult to maintain the trance if they are moving their neck.
Head movement is perfectly, the head nodding.
Okay. Okay.
It is even more comfortable to the client compared to finger movements. Head
Right.
nodding.
Okay. Okay.
Unless like if the head is on a headrest, then it is difficult. Head need to be free.
Mhm.
If the client is in a recliner and head is resting, then
Then
nodding
it
and
is
this
difficult.
is not possible.
And also getting four responses out of head nodding is also difficult.
Hmm.
Four different responses. In ideomotor, we can decide three different fingers
That also can
with
be.
finger.
Yes.
Yeah.
And even if
And
sometimes idiomatic responses do not work because we are doing online session or something, we can always ask them, कि speak out, कि
speak
अभी
out.
Yeah.
आपको कैसा लगता
Speaking out is also perfectly fine.
है
Yeah.
ना? And I remember in one of the workshops of Dr. Jain, I think it was in the first conference, 2023 conference, this is specifically what we were discussing, and Dr. Jain introduced a very interesting concept that initially when we are doing these sessions we feel कि all the protocol should be followed, और अगर client की आंख खुल गई वो ट्रांस से बाहर आ जाएगा, उसके फोन की घंटी बज गई या डोरबेल बज गई, बट ऐसा कुछ नहीं होता. अगर वो 2 मोमेंट के लिए आईज ओपन करते हैं, even if they are out of trance for a moment, we can again ask them, it's okay, relax, take 5 deep breaths, and वो ट्रांस दोबारा से
Right.
resume हो जाता है. बहुत रेयरेस्ट केस में होता है कि वो दोबारा से कंफर्टेबल नहीं हो पा रहे हैं. So
Right.
that is how it works.
Right.
Megha has written something.
I will share the PPT. That is
Yeah.
absolutely. It's not mine, it's in the book.
The PPT, it's the PDF of
Both,
the.
I mean,
Thank you.
PDF of the book.
Yes,
I'll share that as well. Yeah, sure.
thank you so much.
Anybody else has any comments, questions?
Good evening, sir. Good
Yeah,
evening, Madhur.
Pooja. Please,
Good
Pooja.
evening.
Hi, Dr. Madhur. It was a very nice presentation, and
Thank you.
it's
Thank
always
you.
a pleasure to listen to you, whether on social media or like this. Uh, I'm very
Right.
motivated to read the book. I don't have any questions. I just wanted to get my feedback. I'm very motivated to read this book now. I hardly practice. I practice age regression very rarely. I do it, but not on very frequent basis. But I'm very motivated to read this book now. Thank you so much.
Thank you. Thank you so much, ma'am.
Yeah.
I was actually discussing this last time with I think Biljit ma'am and Nivedita ma'am that we should have a book club also, where we come together and discuss the books.
Yes, we
Yes,
all need to
yes,
really
right.
get into more of reading because I think the
Yeah.
experiences of people when they come down into words, it's very essential for people like us who want to learn more and know more. I think it really helps a lot. So yes, these kind of discussions, I feel the clinical needs should continue this. Thank you so much.
Yes. Yes, you're right, Pooja. And yeah, motivation to read, that is also a byproduct of this kind of presentation. Good. Renu, madam, you have any comments, please? So I think there are no comments now. Nivedita?
Yes, sir. So, sir, I would like to mention one thing, like, this time when Jain sir took this age regression, past life regression. So, the point Dr. Madhur mentioned that, क्विक ट्रांस से बाहर नहीं निकालना है बिकॉज you should go step by step, otherwise उसके क्या side effects हो सकते हैं. So that was discussed in detail by Dr. Jain in this contact learning. So yeah, it was good, and we are always there to learn. So again, my same request to everyone that please come up with your presentation. And this is when we had a discussion, and I said we have already mentioned that we are welcoming the reviews of the book or the articles. So I'm happy that we have few more such presentation, like an article is there which was published in some international journal. So I think Dr. Rahul is there. So I have talked to him also. And plus we have 2-3 more. So we'll have, sometime case studies and sometime this kind of, review or learning from the books kind of thing. And thank you, Dr. Madhur. It was really, really
Thank you, ma'am.
very, systematic, and we learned a lot in short. And we really look forward more presentations from you.
I have more books, ma'am.
Yeah.
To read.
Thank you.
Yes, yes, yes. We look
Good,
forward.
good, good.
So,
Thank you.
Thank you, sir.
Thank you,
Thank you,
everyone.
everyone.
Take
yes.
care. Bye. Good night.
Thank you all.
Thank you.
Good
Bye.
night, everyone.
Good night.
Good night. Good.
Good night.